now individualized medicines are possible, period, right? They've happened. So it's here. The question now is, this is a new way of thinking how to treat. I'm going to use rare disease it's a new way to treat medicine, but I'm going to say, anyone, but in rare disease in particular, it's a new possible platform solution to what I consider an incredibly devastating problem. 60 million children that have rare diseases. I mean, it's drastic. And I look back I've been doing a lot of research in the HIV and AIDS era and how that changed drug development. COVID is a good example. My mother has stage 4 cancer, so I've been learning all about oncology as well. Rare disease in children alone is drastic. I mean, it's up there, if not worse than all of these. And 60 million children, each of those have a whole family that's taking care of them. So the ripple effect is pretty huge. And to have a possible platform solution for something, that Mila has broken the ice, but now we have to face it. We have to talk about how do we do this, So I guess the question I have is that I think about is, can we repeat this? Can we scale this? The only way to do that is to treat more children and to get more data and to learn, does it work? Is it safe? And the only way to do that is to treat more children. I think that sometimes individualized medicine scares everyone in this industry because it seems like, my analogies, it seems like a new sport and we don't know what the name of the sport is. We don't know what jerseys you wear. We don't know how big the field is or where the goals are. And, what does the ref do? And, it's kind of scary. Instead of thinking of it that way, I'm starting to think of it more as kind of modernizing the system instead of tearing it down. The system exists. Now we have this kind of new paradigm. So now we kind of have to just modernize with it and not start from scratch. It's not a new sport, I was just reading a statistic that NORD put out yesterday that was talking about how, there's only, a few hundred treatments for rare diseases. And of those, only 10% of them can actually affect 3, conditions or more. And so, when I look at individualized medicine, I see this as an incredible opportunity because it is a platform approach which could cut across a ton of diseases. And for me, the fact is that a platform approach is needed to make a real impact. Otherwise, we're going to be sitting here in 10 years and we're going to have, a few more, however many more treatments. And it's not going to be enough to really make it. There's going to be children getting worse and dying and living lifelong devastating, lives, their entire lives, unless we do something about it. So having a potential platform approach to me is an incredible opportunity, and it deserves really safe and careful and aggressive exploration. So for me, my hope is that, this group of people can help face these questions with the goal of giving this platform approach the best right now, because we need to do this. And as a parent, I'm going to go as far to say that if we as a rare disease community, everyone involved, if we don't do this, if we don't make Everest smaller and, add some maps and some trail maps and some guides and some, if we don't do that, that's actually unethical to me. Because I think that these children and families like mine are living horrendous lives, have no hope, but to have a platform approach that should be explored and might actually really be able to help. It's not only true for ASOs, it's going to happen with CRISPR. I mean, it's just a matter of time. There'll be other individualized medicine approaches, and they are going to depend on this platform approach. So I just want to throw that out there as something else to maybe react to.